I now request on stage Professor Sarang Deo, Deputy Dean Faculty and Research, Executive Director, Max Institute of Healthcare Management, Indian School of Business, to kindly share a few words.
Good afternoon, everyone. Honorable Minister, welcome to ISB. As a member of NATHEALTH as well as the host institution, I should extend my personal welcome to all of you. For those who may not be familiar, while ISB is a world-class business school, features in all the top rankings, we also have a very vibrant healthcare institute as part of the business school here, the Max Institute of Healthcare Management. And one of our missions has been, how do you bring best practices from private sector to improve public health outcomes? And I cannot think of a better forum than this, where we have representatives both from the private sector as well as the public sector, because we do believe that both have to come together if we want to improve population level health outcomes. Individual health, I can go to a hospital, I can get a surgery done. But if as a society, as a community, we want to improve our health, we want to join hands. Dr. Ashish mentioned pandemic. During the pandemic, we were involved very closely with the diagnostic ecosystem in Punjab. We worked with the government of Punjab. That's one example of how an academic institution need not sit in the ivory tower, but we can roll our sleeves and get on the field and do some dirty work as well. And I was preparing for this meeting, trying to understand the health profile of the state, doing much better than many other states. So we should first of all congratulate ourselves, right? There are, of course, well-known challenges. I will not get into those. But one of the things that is peculiar to Punjab, more so than others, is I think non-communicable diseases. Cancer, of course, is one, but also hypertension and diabetes. If I ask anyone, where do you go for hypertension or diabetes treatment, fortunately or unfortunately, it is private sector. It's typically not public sector. That, to me, is not a problem. That's the opportunity. The question is now, how do we activate this ecosystem that exists? People pay for their services, but mostly for treatment. And despite all the best insurance schemes that we have, if we keep paying for hospitalization, we are digging a bigger hole. Everyone in the room will agree to that. So to me, the question is, how can we pool our energies together, create new kinds of models, new operating environments, which pay for prevention, which pay for promotion of better health, for maintenance of health, not just for treatment. And I think that's one role that we can play. So here I'm offering ISB's services, if you will, expertise, to evaluate how these different new ideas are going to work. What works, what does not work? Because often for policymakers, that's a challenge. Everyone comes up with an idea and the idea looks very good. But you also need a very careful assessment, evaluation of what is working, what is not working. So as an educational partner, as a research partner, this is what we have to offer. And I hope that as deliberations happen today, the issue of evidence will come up. I hope people will say that intervention works because it was cost effective in a certain context and it may be cost effective here. And to that extent, we are very happy to contribute to this partnership moving forward. I look forward to the deliberations as much as you are looking forward, so I'll not stand in the way and I'll let the next speaker take over. Thank you so much.